Good morning or afternoon, everyone, depending on where you're located. My name is Toya Bryant, and I am a program specialist with the Oversight and Accountability Division in Central Office. And I would like to extend to you a warm welcome on behalf of our Division Director, Monica Huggins, who is unfortunately unable to join us today, sends her regards. We are excited to host our first Sub-Cohort training for states scheduled to be monitored in fiscal year 2021, which will be our third year of formal monitoring. The purpose of this session is to review and take a more detailed look at the pre-visit phase of the monitoring process. And as Kara stated, we want to make sure that everyone sort of feels comfortable with the information and that you are comfortable with asking questions as we move along. So remember, you can do that either by chiming in verbally or typing questions into the chat pod. So the sub-cohort training is essentially a small group or subgroup of states scheduled to be monitored within a given quarter or period. You've been invited to participate in this training because your state will be going through the OCC monitoring process over the next 6 to 8 months. And I'd like to just briefly pause and give a brief shout out to Pennsylvania and Kansas, who were actually pilot states a few years ago. So we've come full circle with this process and are very excited about the progress that we've made thus far in sharing those details with you. So before we jump into the presentation, I hope that you and your team were able to listen to the pre-recorded National Monitoring Orientation Training, which provides a high-level overview of OCC's entire monitoring process and really sets the stage for today's session. If you were unable to listen to the pre-recorded orientation training, we would still encourage you to do so. The link was emailed to each state administrator, and if you need that, we can also resend it to you. As Kara indicated, there are several resource documents in the pod for your review, which we will reference throughout the training. So for today's session, you'll hear from several presenters on our call. And I'm just going to pause and have each or ask each presenter to just briefly introduce themselves so you can hear the different voices. And again, our director, Monica Huggins, is unable to attend today, and I'm Toya Bryant, and so I'll pass it on to Sherry.
Hi, everybody. This is Sherry Sam. I'm a Child Care Program Specialist with the Office of Child Care, and I work in Central Office in D.C.
Hi, everyone. This is Mary Sprague. I'm the project manager on the WRMA team. And hello, everyone. This is Kara Lenhart. I'm the learning and resource lead for the WRMA team.
And hello, my name is Jesse Farley. I am a monitoring liaison with WRMA and the OCC monitoring team. Happy to be here.
Thanks so much, everyone. So here's our agenda for today's training. So we will review the pre-visit phase of monitoring, walking through the compliance demonstration packet. We will discuss approaches to demonstrating compliance. And we're getting a little feedback, so if you could please mute your lines. We will discuss the 3 pre-visit planning calls and then move into next steps. So you will recall from the pre-recorded training and the communications that we've sent to your state that there are 3 phases of monitoring: the pre-visit phase, the on-site phase, and the post-visit phase. The National Overview handout available from the Downloads pod provides a high-level description of each if you'd like to review them. So again, for today's training, we'll focus primarily on the pre-visit phase. Additional detailed discussions related to the on-site and post-visit phases will occur in your individual scheduled planning calls. Today's training will describe the typical monitoring process. However, we acknowledge that these are not typical times as the country is dealing with the pandemic. And so although our intent is to conduct in-person visits, we cannot predict what the situation will look like as the monitoring visit dates draw closer. So we want to stress that we know just how valuable the on-site visits are, but in the event that we need to shift to a virtual visit for your state because an in-person is not possible due to the pandemic or any other emergency, the monitoring team will reach out to you to plan a virtual visit as an alternative to the on-site visit. So we know that we cannot fully replicate the on-site process virtually. However, should circumstances necessitate a virtual visit for your state, you can expect that the visit would have some of the same kinds of data collection sessions with the state as its partners we would have on site. For example, we will still conduct state and local partner interviews and have system demonstrations. And again, we will discuss case file reviews. And again, all of this information will be discussed in detail later in today's training. So again, if we have to suspend the in-person and shift to virtual monitoring, we will work with you to develop a virtual schedule similar to our working in collaboration with you to develop the on-site schedule or in-person schedule. The schedule will enable us to hold the virtual sessions with the state and its partners at during mutually convenient days and times during your scheduled visit week. Virtual visit sessions will be held via Adobe Connect, the platform that we're using today. And if you're not as familiar with Adobe, don't worry. Leading up to that virtual week, again, if we have to shift to a virtual visit, we will work closely with you in walking through any technical questions and even having some test runs of the system. While monitoring is intended to be a point-in-time review, given the current public health emergency, the OCC monitoring process will look for evidence of compliance under normal operations and not evaluate any waivers or amendments related to COVID-19 that may be in place. And so again, our goal is to confirm that states are implementing the CCDF regulations or are in compliance under normal non-emergency circumstances. The monitoring team will be in discussion with you in the pre-visit phase to determine if emergency measures are needed for your state's visit. And again, if a decision is made to conduct a virtual visit with your state, you will be notified formally. So I am just going to pause here to see if there are any questions.
All right. Thank you, Toya. I don't see any chats coming in or hands raised, but again, do encourage you to ask your questions throughout. We'll pause again in a few minutes to address any of those that come up. And now we're going to turn specifically to the pre-visit phase of monitoring process and look at that in a little bit more detail. So as we mentioned on the national orientation overview, and again, if you haven't yet completed that training, we've added the registration link in the chat pod, so do take a few minutes to go through it. We want to acknowledge that the largest workload for states within the OCC monitoring process is in the first phase of monitoring, and that phase is called the pre-visit phase. And we've noted that states have acknowledged that this is a little different from many of the monitoring or auditing processes that you've likely experienced in the past, which tend to have minimal pre-visit phase work, but significant work while the team is actually on site. And within OCC monitoring, And within this process, the heaviest lift is the document submission process, which actually comes in the pre-visit phase at the beginning of the process. Submitting the requested documents and doing so within the timeframes does take some time. However, spending effort on the process and submitting everything within the timeframes provided allows the process to go smoothly, and it significantly lightens the lift of the on-site visit. So note this looks a little different likely than other auditing processes you've been a part of. So let's talk about what's involved in the pre-visit phase. So this slide provides a high-level flow chart of the state pre-visit activities. And I want to note that you can refer to your own state monitoring activities document that you received with your state confirmation letter, which provides more detail. In red here, we've noted two key documents within the pre-visit phase. The first is the compliance demonstration chart, and the second is the document submission chart. And these two charts are really central within the pre-visit phase. And the monitoring team is reviewing evidence provided on those two charts during this phase, and data collected on the two charts also drives the structure of the on-site visit that follows. So let's talk about how the work on those two charts fits within the pre-visit phase. Before the first state planning call, the state will complete the first chart, which is called, again, the compliance demonstration chart. And in just a minute, Jesse's going to go through that chart in a lot of detail so you'll know specifically how to complete it. But for now, just note that this is a document that allows the state to propose its approach for demonstrating compliance with the 11 monitoring topics and will guide the data collection process that follows. So on state planning call number 1, the monitoring team and the state will then discuss the approaches and make any changes or adjustments to the demonstration chart as are needed. Then moving along to our next box here, the state will complete the next chart, which is called the document submission chart. And the state will send that one to the monitoring team along with all of the written materials. On this chart, the state maps for the monitoring team where to locate the documentation that was proposed on the first chart, on the compliance demonstration chart. This will start the desk review process and support the development of the on-site visit schedule. And again here, data collected on the first chart, the compliance demonstration chart, and the second one, the document submission chart, are the drivers for the on-site visit. We want to note here, something important because some states have missed this, that the compliance demonstration chart and the document submission chart are included together in the compliance demonstration packet. And you should have that, or you can download that from the links pod, but are submitted at separate times in the process. Again, the compliance demonstration chart is submitted first, and that happens before state planning call number 1. And then the document submission chart is submitted second, after the state planning call number 1. Then moving back to our flow chart here, the remainder of the state's pre-visit activities focus around confirming the details of the on-site visit. So I'm going to turn it over to Jesse now, who's going to talk more to us about that first chart, the compliance demonstration chart. Jesse?
All right. Well, thank you very much, Kara. So now we're going to review the actual structure of the compliance demonstration chart, which is the first part of the compliance demonstration packet handout. And we're going to discuss how to complete it. So the instructions for how to complete the chart are provided on the very first page of the document. It looks like this on the screen. The chart lists each of the 11 topical areas for the current monitoring cycle and the specific regulations being monitored for each topic. As you can see, the chart provides space for the state to document the proposed methods for demonstrating compliance for each of those regulations. These methods may be pre-visit documentation, which you would include in column B, on-site activities, which would be included in column C, or in a majority of the cases, it's going to be a mixture of both. Again, the purpose of this chart is for the state to share how it can best demonstrate compliance with each CCDF regulation. The compliance demonstration chart does not need to include lengthy paragraphs or actual links or any documents. The compliance demonstration chart is a high-level document used to share the approach a state will use to demonstrate compliance. The compliance demonstration chart is to be completed and submitted using Microsoft Word. Because the state and the OCC team will be using and editing and sharing the chart in different ways during the monitoring process, please do not convert the document to PDF or another format. It just makes it so much easier in Word. So now we're going to take a look at an example of how you might complete the chart. So you'll see now on the screen that this example is for topic 3, which covers 12-month eligibility. So looking at the layout of the chart, you can see that the regulatory language is provided in column A, and note that there's a header in bold specifically for the regulatory language that tells you the focus of the regulation, which in this case is 12-month eligibility determination and redetermination. Column B is where the state is going to propose its pre-visit method of demonstrating compliance with this regulation. So in this example, the state proposes its on-site demonstration method in column C. The text in the red box shows examples of how a state might complete the form. So for this example, we see that the state is proposing to send relevant sections of its subsidy policy manual and its administrative code for the pre-visit desk review. And for the on-site, they're proposing guided case file reviews and interviews with specific state and local subsidy staff. So you can see that very brief but clear answers are provided here, and that's great. Remember that we don't want details like specific document names or web links in this chart. Just be sure to include evidence for each element, for each regulation listed, and then be clear about what kind of evidence, broadly speaking, it is. For example, a one-word statement like manual in the pre-visit column, that's just a bit too general for the OCC team to understand what the state is proposing. Better thinking would be, what kind of manual is it? Who is the audience? But including the URL for any manual is too specific at this point. Instead, you might say state licensing worker and supervisors manuals, or state subsidy payment processing manual. Remember, completing this chart is the first major step in prepping for the visit. Please remember to complete the chart using Microsoft Word and do not convert it to PDF. So now let's discuss some further examples of possible types of evidence of compliance that might be shared by states on the compliance demonstration chart. Because the regulations that will be reviewed allow for state flexibility and can be implemented in a variety of ways, the means for demonstrating compliance with the CCDF regulations will vary as well, both from topic to topic and from state to state. As much as possible, we want to see different kinds of evidence for each regulation so that we can see not only what policies or rules you have put into place, but also how they are actually being implemented by the lead agency and your counties or contractors and your child care providers that carry out the work. It is crucial to think about all provider types for the topics related to licensing and monitoring and for professional development and other relative offices or programs that you coordinate with to administer CCDF. You need to think about your CCDF program holistically when completing the chart. And while we want you to think comprehensively about the evidence you'll provide, that doesn't mean that we need every single kind of evidence you might have available. Make sure to be strategic and identify the resources that will provide the most direct and targeted evidence for each regulation being monitored. Ask yourself, what will it take to tell our story efficiently around this topic? If the state can demonstrate compliance in 1 or 2 documents, then there's no need to submit 10. If it does take all 10 to show or convey compliance, that's fine too. But we don't need to see duplicative information. That is various documents that communicate the same information. Think comprehensively and strategically about the evidence and provide the evidence that most efficiently tells the story of your compliance. So for pre-visit evidence, That is going to be evidence that can be reviewed by the monitoring team as part of an extensive desk review prior to going on site. Examples of types of evidence that can be obtained in the pre-visit process are things like state rules or statutes and regulations, applications and forms, and manuals for licensing, for subsidy, for provider training, the language or sections of those documents applicable to the 11 topics. Note that this is the list, the documents that we typically review, and we would be looking at equivalent documents from your state. These are just examples. If there are additional documents that the state thinks would be useful for the monitoring team's review, make sure to include those as well. Also note that these examples here for the compliance demonstration chart are very broad examples. They do not really include a lot of great detail, specifically things like there's no specific document name, section, no page numbers. So make sure to keep in mind that you will want to avoid sending any evidence that contains personal identifiable information as well. We want to keep it vague at this point. So now let's talk about some types of on-site evidence. So this can be anything that can be observed in person, either through interviews or demonstrations or case file reviews. When thinking about your state's proposed on-site compliance demonstration approach, make sure to keep in mind who, what, and where. So for example, you may suggest meeting at the lead agency's office for discussions with the state child care leadership team on specific topics or regulations. The on-site column of the compliance demonstration chart is the state's opportunity to outline your vision for the on-site visit. So please be clear about what on-site activities you think would provide the monitoring team with the best understanding of your program's compliance with the CCDF regulations. The monitoring team doesn't need to know the names of specific individuals that you think should be interviewed at this point, but you do want to say which agencies or offices or partners might need to be interviewed for each regulation. You may also want to specify the categories of staff you think need to be interviewed. Likewise, OCC doesn't need to know the names of the specific systems that you want to demonstrate, but make sure to be clear about the kinds of systems. See some of the examples on the screen. These examples show the kinds of language we typically see and the types of evidence we typically look for on site. However, if there is additional evidence appropriate for your state CCDF system and structure, be sure to include it. So I know that was a lot of information, so we will quickly pause here to see if there are any questions.
A reminder that you can chat your question in the chat box for us, or feel free to raise your hand and we'll try and call on you that way if you'd like to share via audio.
So it looks like we may be getting a question in the chat box, but quickly I'll share one question that we often hear in the meantime. Should I include large files, such as management reports, sub-grantee monitoring or licensing staff, or things like that for the pre-visit? Some states have been sending volumes of information for some topics, especially around things like topic 4 or topic 11. So this isn't always necessary. The monitoring team may recommend submitting a sample report for the pre-visit. Sometimes it's best to wait for the monitoring visit when we can actually see a demonstration and discuss the contents of the report. You can reach out to your monitoring team for more guidance on what types of files to send in advance and what to review on site.
So, hi Jesse, this is Toya. We see a question in the chat box from Diane, and she's asking if you can run by drafts with your OCC contact. And so, Diane, I just wanted to confirm that you mean as you're working on your compliance demonstration chart, can you consult with your regional office on the process? Okay, for pre-submissions. So, yes, if you have any questions about completing the compliance demonstration chart, please direct those to your regional office. They can talk through that process with you if you have any questions. But then as a group, the monitoring team will walk through the chart with you to discuss your proposed evidence and to clarify any questions. And at times we may also have some requests or adds. So it is a collaborative process. So if you have any questions in advance of submitting your chart, yes, please do direct them to your regional office. And then as a part of the process, we'll walk with you through that process. So hopefully I've answered your question.
All right. If there are no other questions, then we can walk through the compliance demonstration chart together and look at OCC's monitoring scope for each specific regulation in a little bit more detail. Keep in mind that you can find this document in the compliance demonstration packet, download in the bottom right-hand corner of your screen. At this point, if you prefer printouts, it would be helpful to have two of the handouts available, which is going to be the compliance demonstration chart and crosswalk monitoring rules for cycle 1 in state plan questions. So as mentioned before, this is the cover page for the compliance demonstration packet. And we are going to walk through the actual compliance demonstration chart kind of topic by topic. And we'll move down to our first topical area, which is topic 1, disaster preparedness, response, and recovery. And our first subcategory in here specifically talks about statewide disaster planning collaboration. So this is a topic that monitoring team is going to focus on the collaborative process of developing the statewide disaster plan. Now the monitoring team is going to be looking for evidence both pre-visit and on-site of that collaboration with each agency type listed above. Now states have flexibility in how they define collaboration, and some things that we've seen, if it's possible to send things documentation-wise, things like meeting minutes or notes. You know, we've done interviews with staff who had participated in those collaborative meetings while on site. So kind of think about how it was developed and what kind of evidence you could submit to show compliance with your collaboration piece of the statewide disaster plan. The next piece is the actual statewide disaster plan components on the screen. And I also did want to make sure to mention, you know, that the wording in column A is going to provide you with, you know, the regulatory language and making sure this is exactly what we're going to be looking for. For this piece, the monitoring team is going to focus on the actual components of the statewide disaster plan. So we'll be looking for evidence, both pre-visit and on-site, that the state's disaster plan addresses each of the listed components and that the disaster plan is implemented and monitored. So for component I, which are the guidelines for continuation of child care subsidies and child care services, the monitoring team is interested in plans or guidelines related to the continuity of subsidy services, not just licensing and not about actual care. This is about the continuity of subsidy services. So for component 3A, which are the requirements that child care providers have in place, procedures for, and it goes down through, the monitoring team is going to be looking for all of your provider requirements for specific procedures for each bulleted item, including accommodations for each population listed in the last bullet. And keep in mind that this is for all CCDF provider types in your state. So we'll move on to topic 2, which is the consumer education piece. And we'll talk specifically about the first component of this, which is the posting of monitoring and inspection reports. Now for this, the monitoring team is going to be focusing on the posting of your inspection reports for all of your CCDF eligible providers, not just licensed providers, but all providers who are CCDF eligible. Of course, except those related to all children in care, your relative providers. The monitoring team is going to be looking for evidence, both pre-visit and on-site, that the lead agency is posting those reports according to the requirements above, including reports for required inspections, as well as inspection reports resulting from substantiated complaints. Now, this is a question that we get a lot, and I really want to stress specifically because this is based around consumer education. The monitoring team is not looking for evidence of other types of consumer education. We're looking for the posting of full reports, and those reports must include everything monitored during an inspection, such as areas of compliance, as well as your violations. Families must have access to that information about the full complement of items monitored. Violations resulting in fatalities and serious injuries must also be prominently displayed for the specific provider and clearly indicate the violation. So just to be clear, that is specifically what the monitoring team will be looking for, is the posting of those reports, and that's really what we're looking for consumer education. The other half of topic 2 is going to be your annual aggregate data. And for this piece, we're looking at the aggregate number of deaths and serious injuries and instances of substantiated child abuse. And this rule applies to all CCDF eligible providers, again, not just the licensed provider types. So that is topic 2. We will move down to topic 3. And topic 3 covers subsidy and 12-month eligibility. Our first subcomponent of topic 3 specifically revolves around 12-month eligibility determination and redetermination. So monitoring is going to focus on seeing evidence that the same level of care is provided to the child during 12 months of eligibility, regardless of the allowable changes in family circumstance listed within the CCDF regulations. As part of validating 12-month eligibility during the on-site visit, the monitoring team will review individual family subsidy case records with state and local subsidy staff. Monitoring teams will not remove any files from the premises and will not notate any personal identifiable information. The next subcomponent of topic 3 focuses specifically around continued assistance and job search. So if the state is implementing continued assistance in job search, the monitoring team is going to be focusing on seeing evidence that it is being done in accordance with regulations and with the state's approved CCDF plan. Individual family subsidy case files will be reviewed on site as noted above as well for this. And our last part of topic 3 revolves around graduated phase-out. Graduated phase-out for this piece, the monitoring team is going to be looking for evidence that the state is implementing graduated phase-out in accordance with the regulations, and again, also with your approved state plan. Individual family subsidy case files for this topic area will also be requested and reviewed on site as well. So with that, we'll then move into our fourth topic area, which revolves around child-to-staff ratios and group sizes for providers. So for this piece, we're going to be looking for evidence that the lead agency has in place group size requirements for each provider or setting type, as well as age group requirements, and ensures that providers are in compliance with those requirements. As noted in 98.42C, lead agencies may exclude grandparents, great-grandparents, siblings if such providers live in a separate residence, aunts or uncles from the term child care providers. So again, we would not be looking at relatives as long as they are exempt from this. And for additionally, for the child to staff ratio, because that was group limits. We'd also be looking for evidence that the lead agency has child-staff ratio requirements in place for each provider setting and age group as well. So then for topic 5, which is our health and safety piece, we have 11 different health and safety topics listed out here on the page. The monitoring team would focus on all of these requirements, and keep in mind that topic 5 is very specifically about the requirements or standards for providers that you have in place, not necessarily provider training. That would be covered in our next section. The monitoring team is going to want to see evidence of the requirements for all CCDF eligible provider types, wherever these requirements exist, whether that's in statute, regulations, within any policies or provider agreements, etc. As noted again, lead agencies may exclude grandparents, great-grandparents, siblings, aunts or uncles from the term child care providers. So again, your relative care may be exempted from this. So we're not going to go down through all of the 11 health and safety topics. I would note that you can go back through and review those topical areas, but we will be going through a few brief notes for which would be under the prevention and control of infectious diseases specifically related to immunization requirements. So for subportion A, which relates to immunization requirements, the monitoring team is going to be focusing on those requirements for children receiving CCDF services in all settings, and that also includes license-exempt providers. For immunization exemptions, which is an optional piece, but for this part, monitoring is going to focus on the evidence that the state is following the regulations and also your approved CCDF state plan. And also for the immunization grace period, monitoring is going to focus on the implementation of that grace period for children experiencing homelessness as well as children in foster care as defined by the state in all settings, including your license-exempt providers. Monitoring is also going to be looking for evidence that you were able to coordinate, or that the lead agency coordinated development of the grace period with other state agencies. So just some notes there to point out for the immunization piece of the health and safety requirements. So the next topic we move to is topic 6. Topic 6 specifically talks about pre-service orientation and ongoing training for your providers. So for this topical area, monitoring is going to focus on seeing evidence that the state has established rules or policies around your pre-service orientation for all CCDF eligible providers and staff, and this goes for all provider types, as well as how these requirements are communicated to the providers. Individual provider licensing and monitoring files for different provider types will be reviewed on site, as noted above. Pre-service orientation training requirements must at a minimum address the 11 health and safety topics listed in topic 5, as well as child development. And of course, relatives may also be excluded and exempted. We'll continue on for the ongoing training piece for your providers. We're going to be looking at evidence that the state has established ongoing training requirements for all of your CCDF eligible provider types in accordance with the regulations and also your state's approved CCDF plan. We're also going to be looking at how these requirements are communicated to your providers again. The individual provider licensing and monitoring files for different provider types will be reviewed, as noted above again. For ongoing training, states have flexibility in determining what constitutes maintaining and updating the health and safety trainings, including which health and safety trainings should be repeated and at what frequency. as well as the number of hours, and how the state is taking into consideration each component of the regulation. Again, relative providers may be exempted from these requirements. So that takes care of the training piece. Topic 7 specifically is looking at inspections for CCDF licensed providers. So this is going to be where we're going to be looking at how you conduct a pre-licensure inspection as well as annual unannounced inspections in accordance with the regulations and your state plan. Monitoring teams are also going to be looking for evidence that inspections or the state's other provider monitoring activities address provider requirements for pre-service and ongoing training, as well as your standards in the health and safety requirements. Again, as noted above, we're going to be looking for individual provider licensing and monitoring files while on site and review those files as well. Topic 8, very similar to topic 7, except that this specifically relates to your license-exempt CCDF providers. So we're going to be looking for evidence that the state conducts annual inspections for all license-exempt providers in accordance with the regulations and the state's approved CCDF plan. We're also going to be looking for evidence that inspections or other monitoring activities address provider requirements for the pre-service and ongoing training, and we're going to review those individual provider monitoring files as well. And again, relatives may be exempted from this. So continuing down to topic number 9, this speaks specifically to ratios for licensing inspectors, and this is going to be the number of staff who go out and conduct those monitoring activities compared to the number of providers for which they're responsible for conducting those inspections. So yeah, we're going to be looking for that ratio of inspectors to your CCDF eligible child care providers and facilities. And then also we would like to take a look and understand the state's rationale to ensure that the level is sufficient to conduct effective inspections. So if there's anything that can be provided pre-visit, that's always helpful, but that may be a discussion also on site. Topic number 10 focuses on provider compliance with child abuse reporting requirements, where we're going to be focusing on seeing evidence that the state ensures provider compliance with child abuse and neglect reporting, which may be through standards or trainings, monitoring. As noted again, relative providers may be excluded from this requirement. And our last topic to cover for the compliance demonstration chart, and our last monitoring topic, is topic 11, and this specifically goes into program integrity and accountability. So we have multiple subsections for this one. The first is effective internal controls for provider and staff training. Monitoring is going to focus to make sure that the state has processes in place to train providers and also lead agency or subrecipient staff on program requirements and integrity. So this is going to be how you relay information about program integrity to providers and also your staff who conduct the work. Our next subtopic is effective internal controls, which is the evaluation of activities. This is looking for evidence that the state has processes in place to regularly evaluate your internal controls and program integrity activities. Monitoring teams will not review the state's internal control activities, but will look at the state's processes for reviewing and evaluating the effectiveness of those activities. Next would be your state's processes and requirements to identify fraud or other program violations. And this is, we're going to want to look at your processes in place to identify those program violations or any fraud. On site, the monitoring team will not be looking at case files related to fraud or other program violations. This is more around your high level, how you conduct those kind of evaluation and how you identify, what processes you have in place to actually identify them, not the specific. We won't get into the weeds of each case file. And finally, well, I'm sorry, not finally, I have two more. I didn't scroll down enough. Our next one is fraud investigation, payment recovery, and sanctions. This is where the monitoring team is going to be looking for evidence that the state has processes in place to investigate fraud, what your processes are for recovering any fraudulent payments, how that is done, and sanction those committing fraud. On-site, again, we would not be looking at client or provider case files related to fraud investigation, payment recovery, or sanctions, but we'll want a high-level overview of how those are conducted. And finally, our last subsection is documenting and verifying child eligibility. We'll look at what processes are in place for documenting and verifying child and family eligibility for services under the lead agency's policies. This will be where we would review individual family subsidy case files and kind of talk this through with kind of our eligibility piece in topic 3. So that is the compliance demonstration chart, kind of a high-level overview of that. So as kind of a continuation, kind of getting you thinking about the completing and starting, how to start completing the compliance demonstration chart. We very much recommend that you look very closely at the CCDF rule language that is included and make sure that you're taking a comprehensive view of what is expected of the lead agency as well as its CCDF program. As you complete the chart, be sure that you're providing information about each component covered in the rule. If there are bulleted items, make sure that your response addresses each bullet listed. As mentioned before, you also need to make sure that you are providing information about all of your CCDF eligible provider types, including all types of license exempt providers and those that are licensed or regulated by other entities, which include other states. Remember that you can revisit this training as you begin completing the compliance demonstration chart for a refresher of the walkthrough just provided. And of course, if you have any additional questions, please feel free to contact your regional office. And just in case you missed it earlier, please make sure to note there are 2 documents within the compliance demonstration packet that you will complete during the pre-visit phase. The first one we just went through specifically is the compliance demonstration chart. The second one within the packet is the document submission chart. Make sure that you begin working on the compliance demonstration chart now. It's always good to get a head start and to begin thinking about, how you can show compliance at this point. But, and this is important, please do not complete the document submission chart until after you meet with your specific OCC monitoring team on state planning call number 1. And so now I am going to turn it over to Mary, who is going to go into the 11 health and safety requirements a little bit further in depth.
Thanks so much, Jesse. You all will recall from Jesse's walkthrough of the compliance demonstration chart that topic 5, health and safety requirements for providers, encompasses 11 more detailed health and safety requirements. Topic 6 looks at training as it relates to the health and safety requirements in topic 5. Topics 7 and 8 consider inspections related to those health and safety requirements in topic 5. It's really helpful to understand the relationship of topic 5 to those other monitoring topics as you step into the monitoring process. So let's take a look at those detailed requirements and talk through how they fit together and also how they relate to the other monitoring topics. On the screen, you see listed the 11 more detailed health and safety requirements within Topic 5. They include, and I'll just read through really quickly, the prevention and control of infectious diseases, including immunizations, prevention of sudden infant death syndrome and use of safe sleep practices, administration of medication consistent with standards for parental consent, prevention and response to emergencies due to food and allergic reactions, building and physical premises safety, including identification of and protection from standards, bodies of water, and vehicular traffic, prevention of shaken baby syndrome, abusive head trauma, and child maltreatment, emergency preparedness and response planning, handling and storage of hazardous materials and the appropriate disposal of biocontaminants, appropriate precautions in transporting children, if applicable, pediatric first aid and CPR, and the recognition and reporting of child abuse and neglect in accordance with the requirement at 9841E. Under Topic 5, for each of the 11 health and safety requirements, the monitoring team will look at the state's standards and requirements for all CCDF-eligible child care providers. Those standards and requirements are typically set at the state level, but they might be found in many different places, such as state statutes, regulations, administrative rules, or CCDF provider agreements. The state should consider any regulations and rules that provide evidence to demonstrate compliance. So, for example, for prevention of shaken baby syndrome, abusive head trauma, and child maltreatment, the state would want to include any kind of behavior guidance or discipline rules to show evidence. Under Topic 6, the monitoring team will look at the state's requirements for pre-service orientation and ongoing training for all eligible CCDF providers around each of the 11 health and safety requirements. Where these orientation training requirements reside varies from state to state. They may be defined in state statutes, regulations, administrative rules, CCDF provider agreements, or elsewhere. But regardless of where these requirements reside, the monitoring team will be looking for evidence of the requirements in the pre-visit phase and during the on-site visit. The team will want to talk to the state staff and or contractors responsible for setting and implementing the training requirements, and to those responsible for creating any registries or other systems that support and track provider participation. Under monitoring topics 7 and 8, the monitoring team will look at how the state ensures that licensed and license-exempt CCDF-eligible providers are in compliance with both the state's health and safety and fire standards and the state's training requirements around the 11 health and safety topics. Monitoring and inspection work may be done by the staff at the state, regional, and or local level, or by partners. And during the on-site visit, the monitoring team will want to talk to the state-level leaders involved in setting monitoring and inspection policies and designing and implementing the monitoring and inspection databases and systems, as well as those local staff, the licensors and or other staff and contractors who are responsible for actually conducting the inspection. The monitoring teams will look at standards, training, and inspections for all 11 health and safety topics across all CCDF licensed and license-exempt provider types. Note that states have many different terms and definitions for provider types, especially those that are license-exempt. So examples would include things like registered providers, listed providers, family, friend, and neighbor, FFN, and religious exempt. OCC monitoring will look at all CCDF provider types. Because the 11 health and safety topics are addressed across topics 5, 6, 7, and 8, the state should be aware that during the on-site visit, the monitoring team may ask a lot of similar sounding questions as they work to gain a solid understanding of the state's standards, training requirements, and inspection processes for all of the 11 health and safety topics across all of the CCDF provider types. Also remember that the monitoring team will be trying to fill in gaps in understanding and validate information found during the pre-visit desk review. So I'm going to go ahead and turn this over to Kara.
Thank you all. And we want to encourage you again to type your questions in as you think of them. We'll pause again later in the presentation to address more of those. So please do keep chatting those in as you think of them. So here again is our flow chart of the pre-visit phase. We shared this with you earlier in today's session, and we've talked about the first tan box, the submission of the compliance demonstration chart. We talked about that in depth during Jesse's presentation. And now we're moving along to the contents of state planning call number 1. So the primary purpose of state planning call number 1 is to discuss the state's completed compliance demonstration chart and to come to consensus on the items to send for review during the pre-visit desk review, as well as to discuss or demonstrate or provide during the on-site visit. This call typically lasts less than 2 hours, and it takes place about 4 months before the on-site visit. So remember to look at your individual state monitoring activities document for an estimated call date. State planning call number 1 gives the monitoring team an opportunity to discuss any questions that they may have about the state's proposed approaches to demonstrating compliance, clarifying terminology, and making suggestions as may be needed. At the end of the call, there should be agreement about what documents and links the state will provide before the visit for the desk review, when those documents will be submitted, and what data collection activities the monitoring team will undertake on-site to document and or to validate the state's compliance. Also during state planning call number 1, the monitoring team will provide more detailed instructions for the completion of the document submission chart, again the next chart you'll be completing. And this chart, again, provides more detailed information for accessing materials used in the desk review. Using the decisions made during the discussion of the compliance demonstration chart, there will then be a brief, high-level discussion of how the on-site data collection activities might fit into the on-site schedule. And since the on-site schedule will also be informed by the results of the desk review, we won't go into a lot of detail at this point in the process, but it is helpful for the state and the OCC monitoring team to start thinking about how some of the data collection sessions might be organized. It's also helpful to think about how much time might be needed for each session, how long the demonstrations may take, and where some of those sessions may take place, as well as roughly when they should happen during the visit itself. And finally, there'll be initial discussion of the visit logistics. So that will include initial conversations about when to start on day 1, things like space and audiovisual needs for the data collection session, and so on. So back to our flow chart here. After state planning call number 1, the regional office will send a summary of the agreed upon changes or the additions to the compliance demonstration chart to you, the state. And the state's team then will review and update and submit a revised version of that chart, the compliance demonstration chart, based on agreements that were made during state call number 1. And that process usually takes about a week. The state will then identify any documents or links to include in the pre-visit desk review and complete the document submission chart. So again, that's the second chart, with detailed information related to the identified materials, documents, and links. The state submits the document submission chart along with listed attachments to their regional office. And the completion of the document submission chart and the gathering and submission of those related materials should take the state no longer than 1 month. Between the receipt of the state's materials and the next planning call, state planning call number 2, the OCC monitoring team will conduct an extensive desk review. And based on the information collected during that desk review process and the information from your completed compliance demonstration chart, the monitoring team will also start developing a draft of the detailed on-site visit schedule. So here is a screenshot of the document submission chart that we just mentioned. And again, you can refer to the document submission chart section of the compliance demonstration packet, which is one of your handouts. The state completes and submits this chart, the document submission chart, to the monitoring team along with the agreed upon desk review materials. Like the compliance demonstration chart, it is organized by topic and by the specific regulations being monitored within each topic. The chart gives both the state and the monitoring team an opportunity to organize and catalog the information being submitted for the pre-visit desk review. And we're not going to go into detail regarding this specific chart during today's training. Instead, the monitoring team will provide you with additional instructions during the pre-visit planning calls, specifically at the time when it's time to complete it. And in addition, they'll send you a little how-to mini training that can help you when it's time to go ahead and complete this chart. So watch for a just-in-time training. So at this point in the process, you'll be about 3 months into the pre-visit phase and about 6 weeks before your on-site visit. You'll have submitted your pre-visit materials and the document submission chart to the monitoring team, and they will have completed their initial desk review. The next step is for you to meet with the monitoring team again on the second state planning call, and Mary's going to talk us through that call. Mary?
Thanks, Kara. The purpose of call number 2 is to refine the on-site visit schedule to ensure that the monitoring team will leave the on-site visit with all the information needed to determine the state's compliance. That might be new evidence or evidence to validate what was documented during the desk review. On state planning call number 2, the monitoring team will discuss questions from the desk review that have a bearing on the completion of the desk review. The monitoring team will also highlight any topic areas or regulations that need additional follow-up on-site. You'll also review and discuss the proposed on-site monitoring schedule, looking at details and logistics, who and what does the monitoring team want to see, when and where, and what will be discussed, demonstrated, and viewed. You will get detailed information about OCC's process for selecting the case files that will be used during the family and provider guided case file review. That process will be modified to discuss any state-specific considerations, and I'll talk through that process in a minute. Finally, on that call, we'll answer state questions and identify next steps that both the monitoring team and the state should take to continue visit preparation. All right, so on to the case file selection for guided case file reviews. So as we just mentioned, during state planning call number 2, the monitoring team and the state will discuss in detail how case files should be selected for guided reviews. This is a place where we've had a lot of questions, so we want to tell you about how it works. You don't need to leave today's call and begin gathering case files. You just need to have a sense of what is coming. The monitoring team will work with you during the pre-visit phase on the details of this process. There are 2 types of case files reviewed during the on-site monitoring visit. The first type is provider monitoring and inspection case files, and the second type is subsidy case files. That is family case files, so we're looking for family eligibility. For each type, there's a selection criteria that the state will follow, and we'll look at both of those in this presentation. For both types of files, know that the monitoring team is not looking for stacks and stacks of cases, nor a statistical sample. Typically, the total number of cases for review is fewer than 10 per data collection site. Also remember that this is a point-in-time review. So for example, if a provider has been licensed since 1994, we don't need to see all 25 years of inspection history. Instead, we're looking at recent monitoring and enforcement over the past year or so. For the guided reviews of provider monitoring and inspection case files, the monitoring team will split into teams to visit local licensing offices or other sites where the provider inspection records are kept. This would look different in states where the work is centralized. At each of these locations, the state will provide at least one case fitting into each of the categories that you see on the screen. Includes a fatality or serious injury, shows a visit that was the result of the complaint, shows a corrective action plan. It's important to know that a case may fit into more than one category. Across the visit locations, the state should provide case files from the full range of provider types appropriate to the state, including licensed homes and centers and license-exempt providers receiving CCDF subsidies. So we talked about those earlier. That would include relatives, government-operated programs, religious-affiliated programs, school-age programs, camps, etc. In addition to looking at the documentation for the category listed above, the monitoring team will look at each case for evidence of required inspections, so pre-licensure and annual as appropriate to the provider type. It's really important to remember that during the on-site visit, staff at your state's various data collection sites will need to walk the monitoring team through each of the cases selected to tell the story of the case. So showing how it fits into the category, showing how it demonstrates the state processes and procedures in action. In addition to looking at the documentation for the categories listed above, the monitoring team will also look at each case for evidence of required inspections. So pre-licensure annual as appropriate to the provider type. Okay, so for the guided reviews of subsidy case files, the monitoring team will split into teams to visit local subsidy offices or other sites where subsidy family records are kept. Again, this would look different in states where the work is centralized. At each of those locations, the state will provide at least one case per data collection site fitting into the categories that are shown on the screen. So shows redetermination at 12 months, shows continued assistance after non-temporary cessation of work, school, or training activity if the state chooses to discontinue assistance in those situations, shows closure before 12 months, shows initial job search if the state chooses to offer this option, shows graduated phase-out implemented at redetermination if it's applicable. Again, note that a case may fit into more than one category, and remember that during the on-site visit, staff at the data collection site will need to walk the monitoring team through each of the cases selected to tell the story of the case. Again, you do not need to leave today's call to begin gathering the cases, but you should have a better idea of what to expect. And we will work with you during the pre-visit phase on the details of this part of the process. All right, so back to our flow chart. After state planning call number 2, the monitoring team will send the state an updated copy of the detailed draft on-site schedule. It's important for the states to review it carefully and confirm all participants' times and locations, since these details are included in the on-site visit schedule. We want to ensure that the right people are in the right place when and where they're needed, and we want to be considerate and respectful of everyone's time. You'll want to work with your state staff and partners to review the family and provider case file selection process and determine what steps need to be taken to have files available and accessible to the monitoring team when they come on site. Between state planning call 2 and 3, the monitoring team will continue to refine the on-site visit schedule. And note that the final on-site visit schedule will include the topic areas and specific aspects of the regulations that will be discussed for each of the data collection sessions. We want to use the schedule as a guide for what to expect for the on-site visit and to be prepared for the conversations for each of these sessions. So with that, I'm going to turn it over to Jesse to continue and talk through state planning call number 3.
Thank you, Mary. I think we might want to pause briefly. Case file selection and guided reviews are always kind of a big topic, so we wanted to pause, I think, for some questions, if anybody has any. Okay, we'll have another opportunity in, oh, I'm sorry, there was a question coming in.
So I see there's a question about how times are set up for state calls. It's a really good question, and we're going to talk about that in the next steps. But basically, the monitoring team will send out doodle polls for you and your state team, your monitoring team, who you're going to gather to fill out and see when your availability is. And the state calls will be scheduled based on your availability, based on those doodle polls. And we'll talk a little bit more about that when we get to the next step. Does that answer your question? Okay, great. Are there any other questions before we move on?
All right. Well, then with that, we will move on to discussing the third state planning call. So, state planning call number 3. This is the final one in the pre-visit phase. It typically occurs about a week or so before the on-site visit and only lasts for about an hour or so. State planning call number 3 represents the final opportunity for the full OCC monitoring team and the state's full team to talk prior to the team's arrival on site. This is when we'll confirm details about session start and end times, participant, presenter, and room names, audio-visual needs, etc. This is going to be also an opportunity to address any of the state's outstanding questions or concerns and to provide clarifications about the data collection process, especially around system demonstrations, interviews, or off-site visits. So after state planning call number 3, the OCC monitoring team will finalize and share the on-site visit schedule, and the state and the monitoring team will both complete their last-minute preparations for the visit. Now for the state, that means sharing the final visit schedule with staff and partners and ensuring that they are prepared for the visit, confirming room availability and audio-visual setups, confirming that selected family and provider case files are in place and ready, available, and accessible for the OCC monitoring team, preparing the state's entrance conference presentation, as well as preparing for any system or process demonstrations. Now, it's very important that states don't over-prepare for the visit. There's no need to copy, organize, or flag case files. There's no need to prepare presentations for the data collection sessions. It's very important. We don't want pre-made PowerPoint presentations for data collection sessions. State or partner staff may be asked to provide system or process demonstrations, but those demonstrations will be agreed upon during the state planning calls and conducted by state-identified staff who are familiar with them. The monitoring team will conduct in-depth interviews with those state staff and partners, and those interviews are technical, but they focus on the processes within a staff's day-to-day jobs and on validating and clarifying information provided by the state during the pre-visit desk review. Now, preparing for the on-site visit shouldn't be a high-stress time for the state, although, generally, any kind of audit is, but it really doesn't need to be. Because this is a collaborative process leading up to the visit, there shouldn't be many, if any, surprises once the monitoring team arrives on site. Think of this as an open book test, not a pop quiz. I mean, after all the pre-visit work, it's finally time for the monitoring team to come on site. We won't discuss the on-site visit today, but remember that you can revisit the National Monitoring Overview training for a high-level overview of both the on-site and post-visit phases. So with that, we will pause once again for any additional questions about the pre-visit phase.
I see that some folks are typing, so we'll give people another minute before we move on to next steps. And you can type your questions into the chat box, or you can unmute yourself and ask out loud, whatever you're more comfortable with.
So there was a question regarding the availability of the recording for today's session. Absolutely, we will be sure to get that out to all of you as quickly as it's available so you can reference this training as well as pass it on to others who may benefit from it. And with that, I think we'll move it on to Sherry, who's going to close us out today.
Thanks, Kara. So now that you've all heard a lot of information about this, hopefully you've had a chance to absorb it. But we'll talk a little bit about next steps. So the first thing is that we really strongly encourage state administrators to gather your monitoring team and involve them in all phases of the process. At a minimum, we strongly suggest including other state-level CCDF leadership, those who are responsible for areas such as subsidy, licensing and monitoring, emergency preparedness, consumer education, and professional development. As we mentioned earlier, when someone had a question about planning calls, the OCC monitoring team is going to send links for online scheduling polls. Please review those with your team and the key participants and have them respond as quickly as possible. As you heard in this session, the state planning calls are a critical part of the pre-visit process, so it's extremely important to get those on everyone's calendar before all those calendars fill up. Next, we recommend reviewing the resources sent to you by OCC. Remember that you can revisit this training at any time. As Kara just mentioned, it will be recorded. But be sure to take time to review the sections on completing the compliance demonstration chart and on what kinds of evidence to propose for the pre-visit review and for the on-site visit. The state's monitoring team should start completing the compliance demonstration chart as soon as you have your monitoring team together. And a few reminders, as Jesse had mentioned earlier, it should be submitted at least 2 weeks prior to state planning call number 1. So, and if you have questions and as questions come up as you and your team are completing it, please feel free to contact your regional office and they can assist you in getting that done. It should not take a lot of time to complete. You'll have a chance to walk through the compliance demonstration chart with the monitoring team on state planning call number 1. So your chart should include high-level ideas and not specific details like links and document names and page numbers. After state planning call number 1, the monitoring team will send the state a summary of the agreed upon changes if there are any. And then you'll be able to revise your compliance demonstration chart and resubmit it. And as Toya had mentioned earlier, this is a collaborative process. And so that's kind of the outline of how that process will go. And there'll be as much back and forth as is needed until that compliance demonstration chart is ready to go. Remember that the document submission chart should not be completed until after state planning call number 1. There will be time to review how to complete the document submission chart during that state planning call, but also watch for a link to the mini training on the chart as well. Lastly, OCC is developing resources to help states prepare for monitoring. So in addition to what you've already received, as more resources become available on the website, the monitoring team will notify you and you'll be able, and we'll share those resources with you. There's also an additional resource for you and your state partners, and this is called the OCC Monitoring Process Guide for States. The guide provides details about each of the steps of the monitoring process and can be downloaded through the OCC website. But we've also included the process guide in the download pod here in the Adobe Connect room. So if you see that at the bottom of the pod, you can download it as well. And this really outlines the whole process start to finish and a lot of information. So it's something that you can share also with your partners if you feel like it's appropriate for them to get an idea of what the monitoring process is like from the state's perspective. And with that, I'll pause one more time for any last-minute questions before we wrap up. Any questions? Okay, well, I don't want to take too much of your time. I know we're short on time, but I just want to thank you all so much for joining us. We appreciate your attention and engagement during the session. Again, if you have any other questions that haven't been addressed, please feel free to type them into the chat box. Or you can also, as you go through the process, reach out to your regional office. And we want to be sure our trainings really meet your needs. So if we welcome your suggestions, if you have any suggestions regarding additional training sessions or resources that might be helpful. So thank you all again so much for joining us and for participating, and we look forward to working with you on monitoring in the upcoming year.